89,000 people in South Carolina alone are living with Alzheimer's disease. And over the next 6 years, that number is expected to jump by 35%, according to the Alzheimer's Association.
Now, the story is the same nationally, which is why so much is being put into research to help better diagnose the disease and prevent it. This month, there have been some major breakthroughs in both departments. 7 News anchor Diane Lee explains what you need to know in this original report.
Many people may not realize that Alzheimer's is the 6th leading cause of death in South Carolina, and that this state has the highest death rate from that disease in the nation. But there's also a lot of support that families need to know about, and promising new research that may very well help you ward off the illness.
Remember that one?
Out west somewhere.
Mesa, Arizona. Remember?
54 years of marriage, countless memories, and a whole lot of love.
We've been blessed.
Lillian and John Paxton in Greenville look back on the years with gratitude, but it's not as if they haven't had their heartaches.
My father and my grandfather both were in the North Carolina Mental Institution for years, and they both died there.
Your daddy died in the nursing home. You had to take him there.
John living with the same disease for a decade.
His granddaddy died, and they both had Alzheimer's.
But for the Paxtons, it's all about perspective.
I think we're very fortunate, and I think it's because early doing something instead of putting your head in the sand. I mean, you have to face it.
But looking back at my grandfather and my father, and then me, what have we done different?
They weren't on the medicines. They didn't stay involved in things like that. And no one even tried to help them. No one knew how to help them. It was a dead-end road.
And you can also see the brain atrophy up here.
Today, there's hope. Dr. John Absher with the Dementia and Neurobehavior Assessment Clinic at Prisma Health in Greenville says recent discoveries about Alzheimer's are more promising than ever.
This is a good time to be involved with Alzheimer's research because we are turning over a lot of new information. We're starting to see some progress in terms of diagnostic tests and things like that.
His research focuses on a possible link between concussions and Alzheimer's, one of hundreds of studies throughout the nation on various aspects of the disease. This past month, 2 promising results were released. One, a blood test found to accurately diagnose one type of genetically related Alzheimer's up to 16 years early. The other, a possible breakthrough in preventing cognitive decline that the Alzheimer's Association says could impact us all. It found when blood pressure was tightly controlled to 120/80, it reduced the risk of developing mild cognitive impairment in about 20% of participants.
Which is the most definite finding that we've seen so far. The benefit to the target population was so great that they ethically had to stop the study so that the placebo group could begin doing the things that were benefiting the rest of the participants.
The Johns Hopkins report published in the journal Neurology also found if a specific blood pressure medicine was used, a potassium-sparing diuretic, the Alzheimer's risk dropped by 75%. And lowering blood pressure may not be the only key to preventing cognitive decline. Another recent study points to better dental health that can help ward off infections.
We don't understand how the interaction works and why and to what extent inflammation plays a role, but it does seem to be playing a role.
Whatever the cause, and for Paxton, doctors believe his case is genetic. The Alzheimer's Association is committed to helping families. This support group, called Connections, brings together patients and caregivers, connecting families like the Paxtons with others going through the same challenges. There's also a 24/7 helpline and countless programs that educate and assist. The Paxtons believe both medication and staying active have slowed the disease.
John still plays bridge.
I sing in the choir at church.
Get involved and do what you can. And don't look at it as a death sentence. Look at it as a challenge.
In the Paxtons' perspective,
but Mary's book's going to be a thriller.
Alzheimer's has shown them just how precious the moments are together, even as the memories fade. Paxton has also been involved in research studies, and if that's something that interests you, the Alzheimer's Association can help connect you with studies going on in our area. The organization will also pay for a caregiver to stay with your loved one so you can attend one of its many programs. In the studio, Diane Lee, 7 News.
Now, we mentioned earlier the high death rate in South Carolina from Alzheimer's. Doctors are beginning to suspect, since the Palmetto State also ranks poorly when it comes to overall health, The blood pressure issue could explain why so many South Carolinians succumb to the disease. For more on the symptoms, research, and help that's available, head to our website, WSPA.com, and look for this story.